Okay.
I just hit the record button. Is probably why it dinged on you.
Okay. Are we ready now?
Yes, we're ready to go.
Okay. Okay. Before I get into the actual presentation, I do want to take 1 minute to tell you a little bit about SCORE for those who don't know. We're an organization of volunteers. We're mostly retired, but not all, and we've all had either owned business or been executives, and we give free one-on-one counseling for small businesses. If you want a SCORE counselor, you go to score.org, which is our national site, and choose a mentor. They will ask for your name, what advice you want, and your contact information. They will send it to us, and we will get a hold of you within 24 hours. Today, we're going to be talking about risk management for businesses during the pandemic. And
sorry, I thought this presentation was about website.
This one, that is next week.
Oh, okay. Well, I'm afraid I don't really need this one, so I'm going to log off. But thank you, everyone.
Oh, thank you, Hope.
Okay. Do we still have an audience?
Yes. Well, Trong is there.
Okay.
And I want to know about this because we are in the middle of it.
Okay. I'm going to focus on two types of liability. There are claims that come out of COVID transmission that occurs in the business or workplace. And then there are claims that are related to employment issues that relate to violation of federal, state, or local laws. I'm going to go through these first slides pretty fast because I want to spend some time on FERCRA at the end. It's a little complex. Critical steps to planning are you start early. You need to develop safety protocols. You need to set out what requirements you are going to have employees take so that you limit risk. And you need to develop ongoing communication, a reporting procedure for exposure, and response plan for a workplace exposure. When you are doing this plan, there are four things you should keep in mind. And I say number one always is the safety of customers, employees, and vendors. Effective communication throughout the process I'll be emphasizing that. Being nimble. The information and rules change often. And you need a commitment to the long-term health of your business. And I worded it that way because I want to emphasize that you think now about the impact of the decisions you have to make today on your long-term business health. Just getting the doors back open if you're closed is not something that is more important than thinking about what the long-term impact of your decisions are. Even if you're only one or two people, you need to think through all of these aspects of how you do business: HR, finance, risk management, legal, and communication. Avoiding transmission-related claims. There are risk-reducing protocols that you can use. The first is the use of a pre-return-to-work questionnaire, and I believe that the Chicostart website has a sample of that.
Yes, we do.
It should ask about any symptoms that you have, any recent travel, any possible exposure. And I suggest that you add to that a statement about that the person understands their responsibility to report any exposure immediately to the business owner. I would have them sign that and keep a copy for us and a copy for them. If you're going to have temperature taking stations, you need to do it for all employees, vendors, and customers. If you're doing it for one group and not doing it for the others, it's a useless exercise.
I agree.
Another thing you might want to think about is whether you're going to have testing and if you're going to require it. Are you going to have to pay for it? There are a lot of free sites available, and I would strongly suggest employers refer their people to a free site rather than pay the money for a test. The next step that you need to do is to determine the use of what personal protective equipment will be required for each of the groups, employees, vendors, and customers. And they will be probably different for each of those groups. Some of the things to consider are the use of masks, which of course we all are required to use right now. Whether gloves would be helpful for some of the employees that you have or the vendors who are delivering supplies. Whether you need to put up a plexiglass shield to have a physical barrier between the employees and customers. And then you need to think about whether there are other personal protective equipment that you want to look at, glasses, other things that are available. Your next step is to determine how you will implement social distancing. You need to think about what physical changes you need to make. If you're a restaurant, do you need to move the tables farther apart? If you're an office, do you need to move desks? Are there procedural changes you need to make in how you practice work? And what you're always looking for in all of these precautions is minimizing person-to-person contact while you're accomplishing whatever your underlying purpose is. Might want to look at directed traffic patterns. I've seen some businesses that put yellow arrows on the floor that say this is the way you get to this or that. Limiting traffic in common areas such as kitchen, restrooms, and break areas. I would suggest, if possible, you not allow more than one person in those common areas at a time. If there has to be more than one person in, you need to practice safe distancing and be wearing your masks, of course. The employer needs to provide sufficient sanitizing and cleaning supplies and equipment. And then you need to develop a policy and procedure for hand washing, sanitizing, and cleaning. Do you want your employees to have to wash their hands after contact with every single customer? Do you want them to have to sanitize their work area if someone is sat across the desk from them? You need to think through all those things. And then again, you need to emphasize the importance of their reporting any exposure or symptoms as soon as possible. There are two special areas that you need to think about with regard to how you limit exposure. If there's work-related travel that is normally an integral part of your business, the first thing to do is think about whether there are other things that will work. Could you use Zoom? Could you use GoToMeeting? There are a bunch of technical products out there that might make it possible for your employees not to travel. If they absolutely have to travel, you need to follow CDC guidelines, avoid travel to hotspots, and do not allow any employee to travel if they're symptomatic or if they're sick. And when it comes to avoiding hotspots, I've had one employer who had somebody who had to go into a very high-risk area to meet with a vendor, and they asked the vendor to meet them in a suburb outside of the high-risk area in lieu. So you can think about those kinds of things. In addition to business travel, you're going to have concerns about personal travel of your employees. Kind of touchy because you're getting into their own personal business, and especially if they're doing it on their own time. However, you do have the right to require them to tell you where they're going to be and what precautions there's going to be taken so that you have sufficient information to determine whether you need to quarantine them for 2 weeks before you allow them back into the workplace. Another special area of consideration is the use of remote work options. And you need to carefully think about each position in your business and what they do and whether they can adequately conduct their work remotely. If it's a challenge, you might want to consider staggered work schedules, where you have a part of your workforce come in from 8 to 12, let's say, and the other part come in from 12 to 5 or 4, and you have things that they can carry away and do so that they put in a full work day. You need to think about what equipment will be needed to perform the work remotely, and the employer has to provide all reasonable and necessary equipment. For work to be done on a computer, there may be specific software that is needed. You need to explore with the employee, are you going to give them a laptop to take home and use that has the software on it? Are you going to load your software on their computer and have them use their own equipment? That's something you have to negotiate back and forth with the employee, I think. There may be extra communication costs. If you're going to use Zoom on a regular basis for business meetings, you're going to want to get a monthly Zoom contract. So you need to think about that. So you need to do a cost analysis of this whole process and determine if it's cost effective for you to have the person work at home. The other reason that you might want to have someone work at home, and in fact you would, if the employee has symptoms, has tested positive, or has been ordered to quarantine, you're going to have to go through all these considerations about remote work. Regardless of the reason, you need to have some things in mind. If you have a high-risk employee, they may request to work at home. The EEOC has not yet said for sure that they are considering high-risk COVID conditions to be a covered disability. I frankly think that they'll eventually get there, and I would strongly recommend that you make every effort to accommodate an employee who is verified high risk and who wants to work at home, because it might be considered a reasonable accommodation under the ADA. You can take into account FERCLA, and we're going to be talking about FERCLA, and I see remote work and FERCLA as kind of two sides of the same coin. You may have employees that, for some of the reasons covered under FERCLA, don't want to come into the workplace. You may be able to offer them remote work in lieu of the leave that they might get under FERCLA. In all cases of remote work, you need to clearly spell out what hours will the person be working. How is the work to be transmitted to and from the employee? Are there any work rules that are going to specifically apply to the work at home? And then you need to think as the business owner of how you're going to evaluate whether the work is being done satisfactorily. And that can be a challenge. You're not going to be seeing this person working. You're only going to see the end product. So you need to think carefully through how you're going to evaluate that. That brings us to the communication plan. The business owner has at least 3 distinct audiences. Vendors need to understand what precautions you will require them to take to come into your place of business. Are they going to have to change procedures? Are they going to have to wear protective equipment? Customers, what precautions are you going to require? They'll probably be different than what you require of vendors and employees. But you may have to change procedures in how you deliver services, and you want to communicate that to your customers. Consider placing signs on the work site in addition to specific communication directly to vendors or customers. I think it's very, helpful if you are going to require masks for everybody that enters your business to have that clearly posted on or near the front door, because you may encounter customers who don't want to wear a mask. They need to understand that you're not letting them in if they don't, and that's a right that you have. Your communication with employees is probably your biggest challenge. You have to have clear communication about who's responsible for various precautions. What are you doing? What are you expecting them to do? What health and safety procedures do you expect them to follow? You need again to reiterate the duty to report as promptly as possible. I would put these things in a written document, ask the employee to sign it, say that they received those communications. You get a copy, they get a copy. Another part of your training program is, the communication program is training. You need to provide health and safety training, operational change training, and training about the expectations for handling problems with vendors, coworkers, and customers. And I'm going to make a general statement, and I'm going to come back to the last one. You can do this training all face-to-face. I would strongly recommend, if you have a number of employees, if you have turnover in employees, that you either use an online training program, and there are a lot of them out there that you can search out, or you develop your own short video. This way you don't have to keep giving the training program over and over again, and you further ensure that every employee is getting the same information. The reason for the last one on here is the expectations with handling problems with vendors, coworkers, and customers, is that it's highly likely in many businesses that an employee, not the business owner, will be the one who has the first contact with the customer who says, I'm not going to wear a mask. Employees need to understand how much you expect them to handle that and when to call the business owner or a manager in so that they get assistance in handling that process. They also need to understand that if they say coworkers not following procedures, they need to talk to you about that so you can enforce those procedures. All of this communication should be ongoing, and I'm a big fan of highly visible posters placed in the employee area, such as at the time clock, wherever they sign in, or in the break room. It is, I've said this already twice, and I'm saying it again because it's critical for business owners, that they make the vendors and employees aware of the duty to report exposure or symptoms. This allows you to limit the risk for other people. You can also post a sign asking your customers if they develop COVID-19 after being in your business to let you know, but you have no control over whether they do that or not. So what do you do if you have a report of an illness? The first thing you have to do is notify the appropriate state and local health officials. The second thing is to notify others who may be at risk, but you need to remember that you're not allowed to identify the person who reported that they had had an exposure. A retaliation against somebody who is reported is illegal, and giving their identity out to a bunch of people is also illegal. So you really need to protect the confidentiality of the person. Now, if they tell everybody in the world, there's nothing you can do about it, but you should not be the one transmitting to your customers or to their coworkers that a particular person has been reported symptoms or exposure. You need to promptly investigate how it happened. If there's any chance it happened in the workplace, review your health and safety guidelines. Do you need to beef them up? Are they adequate? And this probably happened someplace else, then you go on. You need to exercise such cleaning and sanitizing as is appropriate to your business. If the person may have been in your business while they were exposing others when they were asymptomatic, you need to do a super cleaning and sanitizing of the workplace where they work. It's important to keep open and regular communication with the person who reported exposure and with those who you've identified as having a risk due to that exposure, so that you know where they are in the process. Possible results of an exposure that are kind of a little bit outside of your control. You may be advised to close your business by health officials. You need to be ready for that possibility. It's going to depend on how the person, the tracking of contacts that they do of the person who is a reporter of exposure from your business. You certainly can have the reporter stay at home for the 2-week quarantine period, and an outside health agency is probably going to advise them to do that anyhow. And they may be available, FERPA leave may be available to them. We're going to talk about that in a minute. You might receive requests from other employees to work remotely if they think they've possibly been exposed. And that's something seriously to consider, because if they were exposed and they're asymptomatic, they're carrying on that exposure chain. I'm going to move now to avoiding claims related to employment issues. And I know I'm flying through this, but there's a lot of stuff here. A short summary of the Family First Coronavirus Response Act, FERCLA, and who is an covered employer. Certain public employers and private employers with fewer than 500 employees are covered. Employers with fewer than 50 employees, which is many of our small businesses, may qualify for an exemption from these provisions that apply to related to child care due to school daycare closure, or if the leave would jeopardize the viability of the business. And the DOL didn't spell out these rules at first, but they have now said that an authorized authority of the business who finds one of these 3 reasons applicable is exempted from that portion of the act that deals with child care. And I'll be going through what those requirements are in a minute. The reasons for exemption are if the payment of the leave or extended medical leave would result in the small business's expenses and obligations exceeding their resources, and they wouldn't be able to operate at a minimum capacity. The second reason is if the employee or employees requesting leave would entail a risk to the financial health of the business if their absence would put your business at risk because they have specialized skills or knowledge of business or their particular responsibilities. And the third reason is if there aren't sufficient workers able, willing, and qualified who are available at the time and place needed to perform the work of the person or persons requesting leave under FERCLA. I put the next slide in red because I talked to a number of attorneys in different parts of the country, and they all emphasize this. If you think you're exempt, you ought to gather the documentation, but do not send it to the Department of Labor. That will just invite them to come in and look at you. Have your documentation ready and be willing to present that documentation if someone requests it. And they usually will only do that if somebody complains that you're not giving them leave that they think that they're entitled to. I would point out that the financial reason is the easiest to document. If you're going to go with the fact that the person has unique skills, you need to really be able to spell out that they have unique skills and that those skills are essential to the operation of your business. You can't get anybody else to do that. And if you're going to claim that there's nobody available to do the work who has the skills, knowledge, and ability, you must be able to demonstrate that you made an effort to find people in order to qualify for the exemption. Okay, now we're going to look at what FERCLA actually requires that the employer do for employees. And it's very complicated. I would point out the Department of Labor has 63 pages of question and answers on FERCLA. At the end, you're going to see a citation to that, and I strongly suggest that that's the first place you go if you have a question about FERPA leave, because a lot of the information that you might have to pay an attorney for is spelled out on those 63 pages. Most of it's fairly readable. As an attorney, I think some of it is a little overly complex, and you might want to engage some professional help if you're in one of those areas. But the vast majority of it's pretty straightforward. The first three reasons for leave are leaves that are reasons that entitle a person to 2 weeks, and that's up to 80 hours of paid sick leave at their full rate of pay or the minimum wage, whichever is higher, up to $511 a day and $5,110 in a 2-week period. And those reasons are that the person is subject to a quarantine or isolation notice, or that they have been advised by a health care professional to self-quarantine. And that may be some of your high-risk employees. I, for instance, am considered high risk, and my doctor has told me I pretty much need to be self-quarantined. And then the third one is that the person is actually having symptoms and is seeking medical help. And those are the three reasons that get them the full pay. If they're a part-time worker, they get the prorated amount based on the number of hours that they would normally work in that 2-week period of time. The next three reasons, and I'll go through the reasons, then we'll talk about what you get for them. The first is that the employee is caring for somebody that meets test 1, but they do not themselves meet test 1 or 2. The second is that the employee is caring for a child whose school or place of care is closed due to COVID-19. And the third is that the employee is experiencing any other similar condition as specified by the Secretary of Health. I will tell you the only thing that possibly falls under number 6 right now is the illness that affecting children that is COVID-19 related, but not COVID-19. Otherwise, they have not identified any possible conditions where 6 would apply. If a person meets one of these rules, they are entitled to 2 weeks of sick leave at a 2/3 of their regular rate of pay, or 2/3 of the minimum rate, up to $200 a day, or $2,000 over the 2-week period. They're also entitled for 10 weeks of expanded family and medical leave for a total of 12 weeks. And that is also paid at the 2/3 rate with a $12,000 maximum for a 12-week period of time. And what's tricky about this is that all of this interfaces with the normal leave benefits that an employer provides, and it interfaces with the regular Family Medical Leave Act, which is a completely different body, but the two of them mesh together, and the Department of Labor explains when one takes precedent over the other. The bottom line is 12 weeks is the max you're going to get, whether you're using FERPA or FMLA, and you can't add the two together and get 24 weeks, or you only get 12 weeks. That's still a lot of money for any employer to pay. And for that reason, sorry, my phone has decided to chime. For that reason, employers who pay out leave under FERPA are eligible for tax credit that covering dollar for dollar the amount that they paid under FERPA, and that includes adding in the amount you paid to keep benefits going for those employees. So it's not just their direct salary, it's the cost of their health insurance, whatever portion of that you pay. All of that can be included. I strongly recommend that you keep separate records of any money paid out under FERCWA, so you can easily pull that up and determine what tax credit you're entitled to. The Act also requires the employers to post a notice of FERCWA in a conspicuous place on its premises. And it requires that you not discharge, discipline, or otherwise discriminate against anybody who has asked for leave under FERCWA. That's a lot of information, and I've thrown it out there very fast, but there is help available. Department of Labor has the 63 pages. Many professional associations offer detailed information. SCORE has a complete COVID-19 information center at score.org, and you don't have to sign in to use that. As just you come into the website, you don't have to log in. You can go directly to the COVID-19 center, and there is just a huge amount of information there. And as I mentioned earlier, you can ask for one-on-one counseling. And the last slide that I have is a list of resources that are available online. The first one there is the DOL Q&A, the 63 pages. The second one is a poster that you can just print off and use in your place of business. The third is a very good online how to when and how to wear a mask that I recommended to employers they might use rather than trying to reinvent the wheel. Fourth is OSHA has an entire book of COVID-19 requirements, and you can find that online. The decision tree that I put on here is a little convoluted. It's going through my professional association when I was working, which is College and University Human Resource Professionals. And it is a decision tree that was posted by Berkeley. While the language may be higher education oriented, the points of decision and the criteria that are outlined in that decision tree are valid in every business. So it is a tool that's available. Other organizations have decision trees available, but I just put one on so you'd have one for sure. And the last citation is to EEOC, and that deals with whether it's a covered disability in any way, whether they're symptomatic, asymptomatic, or high risk. And if you go to eeoc.gov/coronavirus, you'll find a lot of information. That's the end of my presentation. I'd be glad to try and answer a few questions.
I have a few. So if you do have, if you've been exposed,
Right.
and say like in our office, I go to Sacramento, I was exposed. I get a phone call, says, hey, by the way, someone tested positive we were hanging out with. So I call into work, say, hey, I can't come in. I'm gonna have to be quarantined and then try to get a test to make sure, but probably have to stay out the 2 weeks, even if I test negative. That was like one of the questions I had.
Okay. If you feel you have been exposed, you have to go to your employer and report it. And if I were your employer, I would want you not in the workplace. And I would probably offer you the option of working at home if that was viable with given the kind of work you did, or going on FERCWA leave. And as an employer, I would much rather that you work at home if that's a viable option, because I get the work done. I'm not paying you for not doing work. I'm paying you for doing work, and you get your full pay no matter what.
So if you do test negative, should you be able to come back in, or do you think the employer should make you stay the 2 weeks just to be sure?
I think if the person has gotten the test and it's come back negative, the fact is it's taking at least a week for test results in this area. to come back. So they're halfway through what would have been a quarantine period. If they said they got the exposure and they got tested right away, you have another potential week that they could be not testing positive, but be positive. And it's how careful you want to be. I will be honest, if I were the employer and the person could work well from home, I would probably have them work well from home that additional week to finish out the 2 weeks.
Just cover, CYA. It's better to be safe than somebody else in the workplace may not appreciate it.
Yeah. Well, I've always said if I were a guy, I'd wear a belt and suspenders. I'm super cautious. And think about it. If you knowingly put a person who has been exposed in your workplace and another employee or a customer or a vendor is exposed to them and develop it, that is your highest risk, because you knowingly put a person who could have been positive in the area and they were exposed. So that to me says, if I can possibly have the person work at home, I'm going to do that. If they're going to be under a full pay for the 2 week period, because they're going to be in 1, 2, or 3. So they're going to be getting full pay. They may not be working, but they're going to get whatever pay they would have gotten for that 2 week period. And as an employer, I don't want to increase the risk that I'm spreading it to other people who then can claim they wouldn't have gotten it if I hadn't put somebody that I knew might be positive into the workplace.
Mm-hmm. And then traveling to high risk or hotspots, is there a way to find hotspots before you go? Or, how does a person know if you're traveling into a risky area?
If you look at one of the COVID maps that are generally on the internet of number of cases, you'll see the LA area has a circle that's about 5 times bigger than the dots in the rest of the state. And the same thing with places in Texas. So that's a pretty good indication that the number of cases are very high there. You can go online and look up the actual site that you're going to and get their COVID-19 data. And it will probably tell you if the Department of Health considers that a high-risk area. But I look at the map and I see LA, I see Dallas and Houston, and I'm going to consider those high risk.
And then as an employer, what about putting travel restrictions on employees, saying, just in general, say, hey, we work here, we'd rather you stay in our area and not go down to the Bay Area or go to Reno or something like that? Do you have any kind of...
Yeah, I don't really think that if they're doing it on their own time, you probably have a right to tell them that they cannot travel on their own time. You do have an absolute right to know where they're going and what precautions they're taking. And if you don't think they're taking adequate precautions, or if they go someplace and the people in that place aren't taking adequate precautions. Let's say you're traveling to Georgia. A lot of the people in Georgia were never wearing masks. You may then want to say, well, when you come back, I'm going to have you wait 2 weeks to return to. But you can't tell them you can't travel. You can tell them that I can't let you work until I'm positive that you are not positive after you travel to an area outside of where we are.
Yeah. It'd be nice to give incentives for stay safe zones. Not traveling. So if somebody does come down, so say I was quarantined for 2 weeks, I worked from home, it worked out nice, but then one of my, like you were saying, taking care of a family member, so I had to stay home another 2 weeks. So under the rule, it'd be 12 weeks combined total, just helping out different people, or if you were exposed another time. So it would just be 12 weeks total between the two.
Right. The maximum an employer is on the hook for is 12 weeks.
Okay. And that would be the maximum.
Yeah. And the difference, of course, is going to be whether it's paid at full time or 2/3 time.
So reporting to local, state and local officials, is there a place to actually report?
Butte County Health, for us, we would go to Butte County Health.
I'm gonna look up their website.
I don't know that the city has set up a specific city location. I think they're relying on Butte County Health.
I think so too right now.
And then Butte County reports it to the state. So you really only have to physically connect with Butte County, but it will be being reported to the state.
So that's if they test positive, or that you just quarantine them?
And that is if you have someone who tells you that they have had an exposure, and it's not, if they test positive, you don't want them in your workplace if they test positive, obviously. If they've had an exposure, I don't think you want them in your workplace, because it's the new or should have known test again. And in terms of reporting, what the Butte County Health is, okay, you have somebody who's potentially been exposed, let's get them set up for a test. They're going to see that the person gets tested.
So report once a test is positive?
If the test is positive, you're quarantined.
Yeah, definitely quarantine. But
yeah, it's like my husband volunteers in the school system, and he's setting up technology for the grade school for their online education. He's been going to school for 2 weeks. I had him get tested just because I'm so high risk. It took a week for him to get the test results back. And luckily they were negative, but if you get a positive test result, then you're working with an actual COVID-19 infector, if you want to use that term, a person who can be transmitting it, and you have to protect your business by not having them in the business.
And does the county, once you do make a report, what about your tracing procedures? Are they going to ask for those tracing procedures? I mean, so what happens? Is it through the state, the county? Should you be prepared for that kind of?
Yeah, I think that I will tell you, it's my belief that the county health and safety department does the tracing. The employer doesn't actually have to do the tracing. What they are doing is giving the information to county health that John Jones may have been exposed, and here's the contact information for John Jones. Then county health contacts John Jones and says, okay, if you're positive, let's take you're positive, we need to know every place you've been in the last 2 weeks. If it's just the person has been exposed, they're not going to do tracing until they find out the person's positive. That's one of the big flaws with the whole concept of testing. We get too slow test turnaround, and you could actually have exposure in a period of time when you've been tested. but you haven't gotten test results. And they're not going to do tracing until they get a positive.
So if you, it's like at our office, we have visitors sign in, members sign in, so we know people are coming in and out. Only at the time, well, for us, we should just tell them, like, somebody is staying at home in quarantine, so you may want to stay out of the office, and we'll send you the results, or not notify them until somebody's come back positive. I mean, that's 2 weeks of what if that kind of makes it, you're right, that delay is horrible.
Yeah, it's, I would tell you that Zoom is my new friend, because if you have a client, and SCORE does have clients, even though we're volunteer, all my client contact is through Zoom or email or on the phone or FaceTime. And if I had a client who told me that they had an exposure, that's the only way I would do business with them. For me, I do it that way because I'm high risk. But there are other SCORE volunteers, if they have somebody that is exposed, they're going to absolutely have no face-to-face contact with that person for a 2-week period at least.
All right, we're at our time now, Jackie, and I have to say this was really informative, and the information changed a lot since the last one we did. So I really appreciate you and SCORE putting this together, and that we'll share it, and we'll put this on our resource pages, and we'll put the video up as well, and I'll share it with you if you want to send it out to anyone else. Yeah, there's a lot of information here that has changed up, so I'll be checking out some of the links and printing stuff out for our own workbooks for our members. Yeah. So thank you very much, Jackie McCLain. Thank you very much, SCORE. This is our weekly webinar for this week. So tune in next week. We'll be back on our Grow with Google, working with your website, how to get the most out of it, part 1. And go out and be awesome today and be safe and healthy. We'll see you guys next week. Thank you, Jackie.
Thank you, Tim.